Hi, I want to start today with a real story because many women don't recognize this as a perimenopause or menopause symptom. A 48-year-old gym instructor came to see me. Her work involved lifting, demonstrating exercises, squatting, stretching, and staying physically active all day. She had always been strong, energetic, and capable. Post 45, her periods became irregular. She started gaining weight, slowing down, and the most distressing part, her body began to hurt. Not mild aches, joint pain, muscle pain, severe spasms, pelvic pain. The pain would intensify right before her periods. She could no longer exercise. Eventually, she found herself modifying sessions and asking other trainers to take over the more physically demanding demonstrations because the pain and stiffness were becoming difficult to push through. Then came hot flashes, night sweats, and poor sleep. Her words were, "I feel like I'm falling apart." She had been told that this was aging, but it wasn't. This is something we call the musculoskeletal pain of menopause. Musculoskeletal pain is actually one of the most under-recognized symptoms of perimenopause. It includes muscle pain, joint pain, stiffness, and sometimes frozen shoulder. Research shows that more than 70% of women in perimenopause experience some degree of it. Here is why. Estrogen does not only affect the uterus and ovaries, it affects collagen, cartilage, tendons, and the way pain is processed in the brain. Estrogen keeps the joint tissues hydrated, elastic, and able to recover after movement. So as estrogen fluctuates and declines, joints lose lubrication, muscles recover slower, and inflammation increases. That is why many women suddenly notice morning stiffness, aching fingers, knee pain, hip discomfort, neck pain, or difficulty exercising in their 40s. Around menopause, at least 50% of women report joint pain, and about 1 in 5 describe it as their most troublesome symptom. This is also why it is often confused with arthritis or fibromyalgia. The symptoms overlap. Fatigue, sleep problems, mood changes, brain fog, and body pain, they can all occur together. But fibromyalgia originates from altered pain processing in the nervous system, while menopausal joint pain is strongly linked to hormonal shifts. We know this partly because menopausal hormone therapy has been shown to reduce the frequency and severity of joint pain in many women. So when a previously healthy woman suddenly develops widespread body pain in her late 40s, we should not automatically label it as aging. We should think hormones. There is another important point. Pain often worsens right before a menstrual cycle during perimenopause because hormone levels fluctuate dramatically at that time. Many women don't realize that timing itself is a clue. Now, what actually helps? First, inflammation control. An anti-inflammatory eating pattern helps. That means vegetables, fruit, lean protein, and healthy fats. Reducing ultra-processed foods, excessive sugar, and alcohol can lower inflammatory load in the joints. Second, movement. Stopping activity completely often worsens stiffness. Instead, low-impact exercises help, like walking, swimming, mobility work, yoga, and gradual strength training. They keep the joints lubricated and maintain muscle support around the joints. Third, targeted nutrition. Omega-3 fatty acids help reduce inflammation. Adequate protein supports muscle repair. Vitamin D is particularly important because deficiency is common in midlife and it affects muscle and bone function. Fourth, medication as needed. Short-term anti-inflammatory medicines, they can help temporarily, but they are not a long-term solution. For some women, hormone support becomes important. When appropriate and safe, hormone therapy can significantly reduce joint stiffness and aches because it addresses the underlying mechanism and not just the pain. In my practice, I design customized protocols which are based on your symptoms, labs, sleep, and long-term health goals. Combined hormonal care, strength training, and targeted nutrition helps. If your knees, hips, shoulder, or hands start hurting after 40 and nobody can explain why, please don't assume this is simply aging. Your body is not failing, it is signaling a hormonal transition. And you don't have to live with the pain. Reach out and I'll guide you so that you can move more comfortably again.